Hello, we are back again with another episode of Today's Malaysia Talk Show with ILLI and BADRISHA. So ILLI, what's our topic for today? Our audience looks excited to know our topic for today.
Today we are going to discuss more about mental health issues in Malaysia.
That's right, we have invited our special guest for today.
Invited Mr. KHAIRUL from Ministry of Health, Dr. Nisa from KHAIRUL, and Ms. AQILAH, a representative from Befrienders, to explain more about mental health. What is mental health? Does anyone here have experienced mental health issues before?
One of the biggest contributors to the global disease burden is mental health issues. The second major health problem impacting Malaysians is mental illness. According to the National Health and Morbidity Survey, NHMS, nearly 1/3 of Malaysians aged 16 and older experienced mental health issues in 2015. The National Mental Health Strategic Plan was launched on the October 10, 2021 by the Ministry of Health MOH. The National Mental Health Strategic Plan 2020 to 2025 was introduced by the MOH as a long-term strategy to enhance the nation's mental health services. There are plenty of issues that lead to the creation of the policy. Increasing cases of suicide is on the top. In Malaysia, there were an increase of 81% in 2022 compared to 2021. Although it is frequently assumed that mental health issues are the root of suicide, that is not always the case. Suicide risk involves more than just mental health issues. For example, a suicide case that happened recently involved a Malaysian student. The student was only 22 years old when she committed suicide. She left a suicide note blaming herself for being weak and calling psychiatrists won't change her mind either. By referring to the issue, we can see that preventing suicidal cases and behavior is one of the efforts in the National Strategic Plan for Mental Health. Suicide prevention is one of the efforts planned by the government to reduce the suicide cases rate. Given that mental illnesses are so prevalent in the Malaysian community, there is still a great deal of room for improvement in the development of mental health services in Malaysia. Next issue is stigma and discrimination against people with mental illness. Individuals who have mental health issues must have their rights upheld and be free from stigma, prejudice, and discrimination. According to studies, more than 40% of Malaysians would have a mental health issue at some point in their lives. However, some sources place number much higher. Since the scope of mental health issues is much larger, these numbers are frequently unreliable. People hardly ever admit to having these issues, though, because of the social stigma that goes along with them. For example, negative media portrayals. Media portrayals of people with mental illness have a stigmatization and perception altering effect, and they are frequently violent, inaccurate, and unfavorable. Films frequently present mental illness in shallow, stigmatizing, misleading ways. In a study that was released in April 2022, the leading character is depicted as having a mental disorder who becomes quite aggressive in the hit movie Joker. According to the research, seeing the movie was associated with higher level of prejudice toward those with mental illness. Furthermore, according to the authors, Joker may exacerbate self-stigma for those with a mental illness, leading to delays in help seeking. Discrimination and stigmatization may make it more difficult to receive treatment and cause symptoms to worsen. Stigma and discrimination against people with mental illness is one of the issues that leads to the creation of the plan. According to the former Health Minister KHAIRUL Abu Bakar, during the launching day of the Mental Health Strategic Plan, he mentioned that the social stigma that someone receiving therapy is seen to be mentally unsound is one of the many issues surrounding mental health that need to be addressed. Malaysians should normalize mental health care and eliminate the stigma associated with it. Lastly, the increasing strains from family-related stress. It is evident that there are several connections between the mental health of parents and their kids. Children grow when families are strong and stable. Children who are mentally healthy are more likely to have a high quality of life and to perform well at home, at school, and in their communities. Compared to parents who do not, parents who have their own mental health issues are more likely to find it challenging to care for the child. Like I mentioned before, there were a rise of 81% suicide cases in 2021 compared to 2022. Based on the data of the main causes, Malaysians' rising stress levels, which results in mental health problems, is family conflict and domestic abuse. For example, single mothers that experience mental health issues, commonly depression, due to a lack of social support and concerns for their own and their children's safety, single mothers often feel depressed. However, their main problem is struggling financially. It is essential for the government to play their part in helping to prevent this problem. Based on the issue, it can be seen that preventing family-related stress is one of the focus of National Strategic Plan for Mental Health. By implementing programs such as easily accessible mental health services like screening for early detection and intervention, using appropriate tools for many groups in the communities such as the children, general adults, and also the elderly.
That's really worrying. Dr. Nisa, can you explain the purpose of the mental health plan?
Thank you to viewers for giving me opportunity to talk about the objective of the mental health. The objective that relates to National Strategic Plan for Mental Health with the National Mental Health Policy is
to reinforce mental health promotion and prevention strategies and improve mental health literacy, and also want to further strengthen, streamline and coordinate activities related to mental health. Meanwhile, the National Health Policy aims to improve the health, mental health, and well-being of all people by providing a foundation for strategy development and serving as a guide for program planning and implementation. The National Strategic Plan for Mental Health aims to improve psychiatric services for those who are suffering from mental disorders and provide care and protection by families, communities, and bodies related. Mental health sufferers are not seen from the outside, so we must work together to defend and preserve their rights. Strategies include the strengthening mental health resources, improving a suicide prevention hotline, providing free online consultation, building the knowledge and skills of health workers, and equipping the teachers with appropriate knowledge, attitudes, and skills about mental well-being. We can also address the societal behavior by organizing a campaign or requiring a community to participation. This campaign can also be carried by school, college, and businesses. Furthermore, we can raise awareness of the significance of suicide prevention and advocate the ethical media coverage of suicide. Furthermore, by promoting mental health and well-being in all settings and target groups, we can create a supportive environment which can imply positive relations between each other. Other than that, it is also to ensuring that there is no one left behind in the community, like children at schools and students at university, that equips students with appropriate knowledge, attitudes, and skills on mental well-being, as well as to empower students toward positive mental well-being and able to seek help when needed.
That's an interesting explanation, and we have gained a lot from what you shared. Now we should hear from Mr. KHAIRUL about the background of the policy, since he is one of the policymakers.
Thank you to the host for invitation to today's talk show. As for now, I would like to explain about and expose all of you regarding the changes and evolution of the policy of mental health policy in Malaysia. For decades, mental health has been highlighted by the government in dealing with all the problems occurred regarding mental health in Malaysia. In addition, mental health remains an important issue in Malaysia
as there is still much work to be done in order to improve access to care as well as reduce stigma and discrimination. Looking at broader picture, the Malaysian government begins transitioning from community-focused psychiatric healthcare system to a standard framework of psychiatric institutionalization in 1970s. The first mental health policy was the National Mental Health Policy that was formulated in 1998 and subsequently was revised in 2012. By enhancing the general public mental health as well as well-being are among the strategies and principles that have been outlined by the policy. As for 2020, the National Strategic Plan for Mental Health was formulated in order to provide all parties engaged in the provision of mental health treatment and service with comprehensive and ongoing care to serve as a helpful resource for them. Besides that, there are three Regional Act prior to the Mental Health Act 2001, which is Lunatic Ordinance of Sabah 1951, whereas the British passed the ordinance regarding to Malaysia's independence in 1957, the Mental Health Ordinance in 1952 for Peninsular Malaysia, and later on in 1961 for Sarawak, whereas it regulates mental health practice. In addition, Mental Health Act, which Ministry of Health established in 2001, was a significant advancement since it centralized control, called for more modern and compassionate producer, less restrictive, and therapeutic care, include community programs. In order to control the Act, the Mental Health Regulation was created in 2010. That's all for now. Thank you.
I see. Thank you for your detailed explanation regarding on this plan, Mr. KHAIRUL. Today, we are going to present a short clip of an interview with a mental patient. Let's watch.
I fell into a deep hole of depression during the COVID-19 pandemic, when several issues came into my life. It all began when schoolwork started to get very difficult. After years of easy grades, I suddenly had to work hard for it, and the requirements become more complex. After a while, I gave up trying, and I convinced myself that I just couldn't do it. I am lost. I felt very confused, and I have no idea of what I wanted to do for the future. I lost all motivation. I feel like that by giving up and ignoring the difficult things, as life will get so much easier. Gradually, I become increasingly unhappy with myself, and it began affecting other parts of my life, particularly relationship with my family and close friends. But it was not long after a friend of mine showed me a national strategic plan for mental health that was created by the government. There are plenty of strategies stated in there, such as the strategy 6, which is promoting mental health and well-being in all settings and target groups. I found the ads on the internet of Let's Stop Minda Sehat campaign. The Let's Stop Minda Sehat campaign is one of the Ministry of Health efforts to encourage the public to be more open and come forward to share their problems with the people they trust, as well as seek professional help if necessary to achieve better mental well-being. I gained a lot from them, and I feel like I'm being heard for the first time in my life, and it feels better knowing that there's people out there experiencing the same feeling that I do and the problems that I have.
That's really hard when we hear this experience from him.
Yes, it is. Would you like to share any government's approach?
Yes, of course. There are many resolutions by Government of Malaysia regarding mental health plan.
First resolution that can be highlighted is strengthening mental health resources. Government collaborates with NGOs to increase the resources in terms of psychiatry, counselling, etc. because the government was done several programs such as in-service training, continuous medical education, short course and conference for postgraduate psychiatry training before this. It is one of the efforts shown by government to enhance the resources of the mental health. To enhance mental health resources in school, the government will ensure that everyone, including teachers, participate in screening of depression, anxiety, stress skills or DASS to ensure awareness regarding mental health by both teachers and students.
Next, addressing suicide and suicidal behavior is one of the resolutions. The government has taken steps to increase public awareness of suicide prevention. This includes introducing and implementing a suicide prevention program in all secondary schools, organizations, and society. Additionally, the government has increased the number of helplines that speak all major languages. This action can reduce the number of people mentally ill and are in line with the objective to be achieved. Lastly, promoting mental health and well-being in all settings and target group is also one of the resolutions by the government. The government of Malaysia has formulated several activities to increase awareness of mental health issues. These include Let's Talk Minda Sehat, My Mind on Firm, and the Malaysia Mental Health Firm Festival. Let's Talk Minda Sehat encourage people to seek treatment and support in order to achieve mental health being. The effectiveness of these activities can be measured by the number of Let's Talk booths in the shopping malls and the number of school or higher institutions participating in the mental health firm festival competition. The government provides students with appropriate mental health information, attitudes and abilities to increase their awareness and knowledge. Infotainment techniques such as Upin and Ipin are used in preschools, while middle schools and tertiary level students are involved in e-mental health strategies such as #HereForYou on Instagram. Mental health knowledge is important to increase awareness of the public and students and to prevent them from feeling left out.
We have Miss AQILAH, a representative from Befrienders, to explain more about what Befrienders is.
Thank you for having invited me. Hello everyone. I will share about the challenges of mental health issues that are becoming more prevalent nowadays. As Befrienders, I would like to say that there are some challenges that we can see regarding the mental health issues in Malaysia.
The first point is stigma. The stigma associated with mental health problems and mental illness persists in Malaysia, leading to social exclusion and insufficient community support. It can be defined as a negative perception that fosters prejudice and leading to stereotyping and discrimination. Stigma has proven to be a barrier to accessing effective treatment due to a lack of knowledge, awareness, and media depiction. Close companions, co-workers, and healthcare corporations play a significant role in addressing the issues of societal stigma related to mental health. The problem of the mental health landscape have been highlighted as crucial challenges as the number of mental illness continue to rise steadily over time. For example, crazy is the word that is used to refer to a mental illness which carries a bad connotation. This is due to society's multi-religious and multi-ethnic culture which often associate mental disorders with supernatural belief and punishment from gods. This shows that the stigma from community and policymakers are looking at mental health with low regards. The next point is mental health resources. The resources for mental health services and programs are limited, with the primary emphasis placed on the delivery services to individuals seeking treatment at those facilities. The mental organization should be maintained to provide residential services and should be targeted for other specialty services like family therapy, consultation services, services for personality disorder, and eating disorders. Moreover, clinical physiologists and counselors as well as occupational therapists and specially trained nurses are in short supply. A shortage and miscalculation of these professionals will impact providing care and therapy to needy patients, making it impossible to operate treatment fully and the job vacancies available with a low income. As for your information, the financial cost is significant as depression, Anxiety and disability disorders are often left untreated due to financial constraints. The last point is increasing suicidal behavior. Suicidal behavior among teenagers have been a major health issue and it requires a collaborative efforts from family members, societies, as well as relevant agencies and non-governmental organizations, NGOs, working with the Ministry of Health, MOH. Communication within the family is essential to prevent suicidal behavior as the children often allow their irrational emotions to are highly influenced by their peers and surroundings. It can be a stressful life event for young people to take the mental burdens, and the health welfare sectors identify self-harm and suicide aspirative mental health as critical contributors to poor mental health. The National Health and Mobility Survey 2017 found that 7.3% of youngsters had formulated a suicide plan or attempted suicide within 12 months. An ethical news coverage of suicide in Malaysia concerns MOH guidelines, and there is a lack of comprehensive young people suicide prevention approach in terms of quality data collection. Hence, suicide is closely related to poor mental health and is estimated to be the second leading cause of the death for adolescents in Malaysia.
In conclusion, the National Mental Health Policy, which was introduced in 1998, served as a foundation for a mental health policy in Malaysia. The goal of the policy is to improve mental health, ward off mental illness, and help those who need it. However, mental health issues still quite a major concern in Malaysia, despite the presence of the plan. The stigma and the discrimination that continues to surround people with mental health difficulty may prevent them from seeking help. Besides that, due to the lack of resource and staff in this area, access to mental health care is also impeded. Initiative has been made to address this issue, such as expanding mental health service and increasing public understanding of mental health. But more effort has to be done to improve Malaysia's system of treating mental illness. Overall, although Malaysia's mental health policy provides a framework for addressing mental health issues, work still needs to be done to enhance mental health service and eliminate stigma related to mental illness. That's all from me. Thank you.
After listening to all of the opinions and knowledge from our guests, we have finally come to an end of the show.
So today, we gain much knowledge from the sharing from various parties.
Thank you for having us today.